In other news now, Limpopo has been one of a few provinces to report low daily infections of the coronavirus. But with the influx of visitors expected to hit the province this festive season, what's the plan and level of preparedness to mitigate the risks of more cases? Let's speak now to the Health MEC in Limpopo, Dr. Phophi Ramathuba. Dr. Ramathuba, good afternoon. Thank you very much for your time, ma'am. You seem to be getting things right. What are you doing correctly there in Limpopo? Because each time we see, even during the decline, we see the numbers. You've always been one of the lowest provinces. Even when the vaccination drive started, you were achieving some good coverage there, some good numbers. How are you getting things right? Can we just begin with that overriding question first?
Afternoon to all your viewers out there. As a province, what we can indicate is that we always, when we're given a task or a challenge to perform, function as a collective. The provincial government has got systems that they put in place, from the provincial command council, which will be led by the premier, to the provincial resurgence team or the technical team, which will be led by the Department of Health, and making sure that all the relevant stakeholders are in place to make sure that we identify the challenge and we look into our material conditions on the ground. If you go back to when we had to deal with COVID-19 from the beginning, we would come up with initiatives that are tailor-made for a rural province like ours. We would not want to copy and paste what those in the cities who have got better resources than us are implementing. But we learn also from other countries and also learn from other provinces what are the best practice and how can we as a province collectively manage to deal with that. And even when it comes to vaccination, we understood very well that we are told that this process is going to be electronic, and we are a rural province with majority of the above 60 cannot read and write, yet it's worse for them to understand the technology. So we had to devise a means to say, how are we going to register them? And how are we going to override the question that most of our places don't even have network connectivity? So by planning, and maybe to sum up is to say, we plan. And we plan according to our resources, according to what we have, according to material conditions on the ground, and then we execute the plan. And that's why that's the formula for how it's working.
Well, it seems to be working. I mean, according to the latest figures for the last 24 hours, the past period, you got about 1,233 new cases in Limpopo. That's very low, despite the very transmissible Omicron. Now, in planning for the festive season, how are you going to ensure that these numbers stay as low as what we are seeing, if not lower?
Yes, we must admit that we are faced with a challenge. Limpopo, as I've indicated, being rural, most of our people for economic activities, they are in other parts of the country during the year. And this is the time that they will be visiting our province. And we are very much worried about those who are working wherever they are, who are not vaccinated, and who will be visiting their province of birth. That is why you are going to see us on the Premier has already directed. We will be on our N1 with roadblocks in different areas, where, of course, we will also be having pop-up sites to offer you the vaccine. We will also offer you education, because we start with the education. We need to understand that at this stage, when you look at the vaccination program itself, when you started, you will have those who are just, they don't care whatever you are saying about the vaccine, they will rush into that. And there are those who will first wait to see if people who are vaccinated are not dying, and then they come in. Currently, we are dealing with those in psychology we call laggards. They are very resistant. So we know we are going to meet such on the road, who, whether it's because of religious reason or whatever reasons, they are resistant to be vaccinated. We will be offering them vaccines. We will be talking to them. We will be advising them on the importance of the vaccines. And we want to believe that we will be vaccinating them. But equally, not only will we be offering those vaccines, but we will be sharing with them the information on Omicron to say they are going home, learning from what we saw during the second wave after their visit at home, what really happened, what they left at home. And by working together, we can be able to keep the numbers low. But also, secondly, our main concern is for positive reason that Limpopo is known to be a tourism destination for both South Africans and international guests. And this, we welcome all our visitors from all over. We have already working with the tourism through the Limpopo Economic Development Department. Most of our lodges, we have already vaccinated their staff and will even go to them and vaccinate their staff there. So they also encourage their guests to take up the vaccines. And all of them, they are trained on how to comply with COVID-19 regulations. So we want to reassure all those who have chosen our province as a destination for tourists this particular festive season. This is one of the safest provinces that you can visit this time around. You are going to be welcomed by peaceful people who are health conscious, who have been vaccinated, who are protected, and who will also protect you.
We wish you well. Thank you very much for your time. Limpopo's MEC of Health, it seems like they've got a good plan on the ground. Dr. Phophi Ramathuba, just telling us how the province is going to be responding this festive season to managing the pandemic and keeping the numbers low. They seem to be well prepared indeed to deal with any possible increases in infections due to any inflow that they are expecting.